Good afternoon, everybody. Welcome to Grand Rounds today. Today, it's my pleasure to introduce Dr. Jacob Meyer. Dr. Meyer is a fellow of the American College of Sports Medicine. He's an assistant professor in the Department of Kinesiology at Iowa State University, and he has very kindly accepted our invitation to present a topic that I think personally is really pretty fascinating. Title of his presentation today is Resistance Exercise and Brain Health, Depression and Cerebrovascular Effects. And please join me in welcoming Dr. Jacob Meyer.
Thanks for the welcome, and thanks to all of you for being here, and those of you online, thank you for attending as well. Today I'm going to talk a little bit about some of the research that I do, as well as the research basis around thinking about how resistance exercise, in particular, not just aerobic exercise, but resistance exercise specifically, can influence the brain. And my own background is exercise and mental health, so I do exercise psychology research, and I focus a lot on how exercise can either be used by itself or as part of a treatment plan for adults with mental health conditions, such as depression, which is my primary focus. So what we're going to do today is we're going to sort of build through thinking about depression, resistance training and depression, how resistance training might influence depression. That's through the cerebrovascular function changes, and then some clean and clear recommendations for how to use resistance training actually in clinical practice. So hopefully it'll have at least something for everybody, and maybe a lot of things for many people. So before we get into it, though, I would like all of us to transport ourselves to Gustav's living room in 1857. So Gustav Fechner was a psychophysicist. That means that he was focused on the way that perceptions or mental phenomena are related to physical stimuli. He was really interested in this sort of brain sensation link. And he decided that every day, 2 hours after breakfast, he would go into his living room and pick up 2 9-pound weights. Now, they probably weren't dumbbells. They're probably like cans of beans or something. And he would lift them over his head at a given pace as many times as he could until he couldn't anymore. And he was trying to figure out, if I continually do this same resistance exercise movement to failure every day for 2 months, what will happen? He was just doing it by himself, but he gives us sort of the first clean, data-based information on what happens when you do the same resistance exercise movement over time. And this is his data. Along the x-axis, you see each day of training, and on the y-axis is the number of repetitions that he did. And so on day 1, he lifted those 2 9-pound weights 104 times. Seems like kind of a lot. I'm proud of him for doing that. But then after almost 2 months, that final data point is 692 times. So he went from 104 to 692 in just 2 months. Now, no matter what it is that we're talking about, if I told you in 2 months you could increase to 700% of whatever you started with, you'd be like, oh, I'm going to sign up for that. That sounds like a good idea. Here, what we really see is just the sort of the beginnings of thinking about strength training and how it can change our body's capacity over time. And the take home from Gustav's early work was just that repeated strength training is powerful. It can lead to changes in capacity and likely into other things. He didn't get into the details, but now as we, in the intervening 165 years, we've thought a lot more about resistance training. Questions now become things like, well, if someone does resistance training, how does that influence that person? How does that influence their mental health? Maybe feelings of depression, does that change it? Or maybe their cerebrovascular function. So we know that depression is a big deal, and I'll show you some data on that in a second, but cerebrovascular function is also really important. It's related to Alzheimer's disease, dementia, many of the issues that can arise during aging. And so we've tried to think about resistance exercise in lots of different ways since Gustav, but it's been important to sort of pull together the history to get us on the path that we're on today. So we're going to think about, and I'm going to bring Gustav back in a couple times, so don't forget him. What we're going to think about today is depression, probably stuff that most of you guys know, but we'll all get on the same playing field there. Then the bit of information we do have about resistance training and depression, there's some useful clinical trial information on how resistance exercise training, or RET, can change depression. Then we'll plug in the how, like how is resistance training changing someone's depressed mood, or someone who's clinically depressed, how is it treating that clinical depression, what's happening? And I'll put forward cerebrovascular function changes as a potential mechanism that might link those. And then we'll end with those recommendations and thinking about what are the future questions that we're asking in this area, either right now through work of colleagues and myself, or that we really need to figure out that's going to be really important for the future of thinking about major clinical health concerns. So, starting off with depression, this is defined by the APA as persistent sadness and/or a lack of interest and pleasure in daily activities. So sadness is sort of the quintessential depression thing that we typically think about, but anhedonia is the second bold part. That's no longer being interested in the things that you used to be interested in, or no longer getting pleasure from the things that you used to get pleasure in. So maybe you were always an avid reader, and now when you read, you're not interested, you're not engaged, it's no longer enjoyable. So these are the two core features of depression, and then they often co-occur with a bunch of other symptoms: insomnia, fatigue, or restlessness, changes in weight, etc. And to meet criteria for an episode of depression to be a major depressive episode, these symptoms have to be present every day or nearly every day for at least 2 weeks. And it has to influence someone's life in a major way, so maybe in their work or at home or socially, or in other areas. Typically, what we're going to be looking at today is thinking about how does resistance exercise training influence people who have clinical depression of a mild level, moderate, severe level, but getting above the clinical threshold. For those of you who hang out in EPIC too much, ICD-10 codes for depression are anything in F32, so F32.0 up to 0.9. Not all of those are used, but those are the codes that we would be looking at in terms of many of the people in the studies that we'll be looking at. Why do we care about depression? Well, unfortunately, it's really quite common, and it has always been relatively common, one of the two most common mental health concerns, along with anxiety, in the past. But since COVID, numbers have really increased. So what we see here across the x-axis is the severity of depression, and then on the y-axis, the percent of people who have that particular severity. And we go from none all the way over to severe. The dark blue bars are pre-COVID, so looking at a national data set from before COVID, and then the lighter bars are during COVID. What you'll notice is that there's a huge drop in the number of people in the none category when we move into the COVID period. And then those 35% or 25% of people who dropped out of that none category sort of get sprinkled throughout the other categories. So there is a much higher rate for each of those other categories than there was pre-COVID. So we're seeing a substantial shift in sort of the average level or the median level of depressive symptoms, and a lot more people who are in those clinical categories. Talking to a bunch of healthcare workers, I'm sure you're not surprised. But I think it's important for us to recognize this and see that, like, for many folks, this doesn't then go away. The pandemic is dragging on and will likely continue to drag on. And even when whatever the post-pandemic world looks like, people who have had one depressive episode are at, I think the last time I checked, it was a 47 times higher likelihood of having a second episode. So now we've just turned a bunch of people from never having depressive episodes to now having that 47 times increased risk factor. So we're going to be seeing this continually over time, whether we're happy about it or not. The other thing is that right around a quarter to a third of people meet clinical criteria for depression. So there's maybe 30 of us in the audience, and that's an optimistic number. Maybe there's 20 of us in the audience. That would mean somewhere 5 to 7 people here in the room, and more online. So this is a thing that's happening in and around all of us. So depression is common. It's become more common. How does resistance training fit into what we know about mental health and depression in particular? You've probably seen this quote, mens sana in corpore sano, a healthy mind in a healthy body around. This is a common motto in a lot of gyms and in other spaces. This is from, I think, 400 BC. I should have put the number on there so that I would remember. But so for a very long time, we've known that there's this link between the body and the brain. And what we want to think about is how specifically does something like resistance training influence the brain? And we can think about it in two ways. So what happens right when somebody exercises? One side of the coin is when somebody exercises and for a short period of time afterwards, how does that change the way that that person is thinking and feeling? Does it improve it? Does it worsen it? What's happening? And what are the sort of characteristics of what determines how that happens? And then the other side of the coin is, well, every time we have someone exercise once, we would really like it if they did it again. So what happens when people consistently exercise? So what are the sort of chronic effects of exercise? If someone exercises, performs resistance exercise regularly, what does that do bigger picture to their subclinical or clinical symptoms of something like depression? And to make this a little bit easier for us to sort of conceptualize, there's a couple of pieces of it. So if we had someone with maybe a moderate depression, if we didn't do anything, that depression would likely stick around. There's some natural fluctuation. It's probably not a straight line, but we'll assume that this is what would have happened if we hadn't done anything. Now we have somebody participate in a resistance exercise session. So maybe they are at home, they do a body weight series of exercises, maybe sit-ups, push-ups, some squats, lunges, a couple of other things, maybe 45 minutes. How do they feel? Well, from the bit of research we have on the acute effects of exercise in general, we see that their depression, either their depressed mood state or their anhedonia, will reduce during that exercise session. So generally, people feel better during the exercise. And the second part is, it actually takes a while for the mental health to return back to baseline. So there's two cool things here. One, can we optimize how much it drops? Can we figure out a way to make it so that the benefit from that single session is the biggest? That would be helpful. And then the second piece is, can we make it last the longest? Is there some way for us to modify the stimulus in some way that these effects are gonna last not 2 hours, but 6 hours or 8 hours or 12 hours or like 3 days? Right now, we know that the effects of exercise in the short term last a number of hours, maybe 2 hours, maybe 4 hours, maybe beyond that, in terms of the mood benefits. So what we see here is that when someone exercises, it affects them for a period of time afterwards, but in a beneficial way. So that's one side of the coin. If we flip to the other side of the coin, and we think about what happens when someone, participates in exercise on a sort of regular basis over time, this time frame is, thinking about days. I don't want someone to exercise 8 times in a day. I mean, maybe, but probably this is thinking on a different, weeks perspective. And what we see when someone engages consistently in either aerobic or resistance exercise, we see that their depression level comes down. Now, obviously not everyone moves in this exact same, 30-degree trajectory, but on average, this is what we see. And in particular, we often see it happen really quickly in the first couple of weeks, and then continue to build over time. So we see the acute effects, that there's a benefit. We see the chronic effects, that there's a benefit. And the question is, what are the parameters that determine how much better somebody feels during or after exercise? So some of the past work that I've done with some colleagues tries to answer this question. So what is it about the exercise that helps people to feel better or differently or less depressed afterwards? So in this study, there were 24 women with major depressive disorder, all of whom were in a major depressive episode at the time, so high symptoms. And each participant engaged in 4 different sessions across 4 different weeks. Either a quiet rest session where they sat quietly on the bicycle and did nothing, a light intensity session where they pedaled, but it wasn't particularly difficult, very little resistance, moderate intensity, or a hard intensity session. And what we saw is that the quiet rest session, that's the top filled in the solid line. We see that when people just sit and don't have to do anything for a period of time, they tend to feel a little bit better. This is sort of a standard thing that we see in a lot of psychological research. But that when they did the exercise sessions, you see that no matter what session they did, it reduced their depressed mood state to a greater level, 10 minutes and then 30 minutes afterwards, than the quiet rest session did. And you see that at 30 minutes, it is indistinguishable which exercise session led to what particular response on average, suggesting that no matter how hard the exercise is, people end up seeing the same depressed mood state improvement, which is kind of cool from like a translational perspective. The answer isn't you have to go to the gym and you have to sweat until you can't sweat anymore, and then you will feel better. Instead, even a light intensity exercise might have the same sort of psychological benefit that harder intensity stuff does, which is useful. However, this was all done on a stationary bicycle. Now, I biked over here. I like bicycles, but it's not the same as resistance exercise training. The problem is that we don't really have resistance exercise training to give us the same type of information. So we can sort of borrow from the aerobic exercise literature to say, like, it looks like intensity isn't too important, but we don't have that data quite yet, which is too bad. So one question is, how big of an effect is there? And it looks like there's sort of a consistent effect without a big influence of the intensity. We've done some follow-up work trying to look at how long do the benefits last. So in a more recent study, we looked at just a moderate intensity exercise or quiet rest session in adults with depression who are in a depressive episode. And instead of just looking at depressed mood state, I wanted to also pull in the other core clinical feature of depression, the anhedonia, no longer feeling enjoyment in previously enjoyed activities, no longer trying to seek out rewarding activities. And we saw that for up to 75 minutes after the exercise session, they had substantially improved their anhedonia, meaning that they felt less anhedonic for at least 75 minutes. And we stopped measuring at 75 minutes because there's only so long people will sit in a really boring exercise suite, not exercising, before you should really let them go home. But theoretically, these effects will continue to persist beyond 75 minutes. So that helps us sort of think about like, okay, so this is lasting a while. Other research in healthy populations, not in a depressed population, suggests that the benefits last sort of in the 2 to 4 hour range. So we're seeing immediate effects and effects that last in terms of the core features of depression. But again, this was biking, which still I do like biking, but we don't have the resistance training or resistance exercise data. It's a little bit easier to get aerobic exercise information because everybody can participate in some kind of aerobic exercise in a way that people are familiar with. So maybe it's walking, maybe it's jogging, maybe it's biking, maybe it's moving in a different way based upon abilities, but it's something that we do typically regularly. Resistance training is a little bit harder to conceptualize. How hard do I need to be working? How big do these cans of beans need to be for me to get a benefit? How many repetitions, how many sets, etc. So we've got a lot of data on aerobic exercise and less on resistance exercise in populations with depression. However, when we look at the literature that's sort of been built up over time, this is a meta-analysis that myself and some colleagues in particular at the University of Limerick in Ireland did. They tried to figure out, okay, so we don't have a lot of data on resistance training in adults with depression, but resistance training isn't like totally new and unknown. Gustav knew about this a long time ago. So there have been interventions that use resistance training as the sort of intervention over 8 weeks or 12 weeks or 16 weeks, but maybe focus on a different outcome. Maybe they were focusing on frailty or balance or cognitive function or something else, but they also included a measure of depression. So we looked for those studies so that we could figure out, are there any randomized controlled trials that included a measure of depression and uses resistance training as the intervention compared to some control. And then we summarized all of those different studies. So each line up here is a different study along with the estimated effect on depression that they got, and then the whiskers are the confidence interval from it. You don't have to, there will be no quiz later that says what did Sing et al. Find. The take home from here is that the mean or the average across all of these is that we see about 2/3 of a standard deviation reduction in depression after engaging in a randomized controlled trial of resistance training. So after engaging in an intervention for resistance training. 2/3 of standard deviation. What the heck does that mean? Well, most of our psychological interventions like CBT or acceptance and commitment therapy or other types of therapies have roughly a 0.6 to 0.7 effect size change in depression, anxiety, PTSD symptoms, etc. Most of our pharmacological interventions have similar effect size changes. So what this is showing us is that resistance training has a similar amount or magnitude of change as many of the sort of standard things that we prescribe for treating things like depression, so therapy or antidepressants, which is pretty powerful. However, most of this wasn't done in depressed populations, which could conceivably have a better response or a larger response because they've got more room to move, but we don't have that much data yet. And I think one thing that was interesting from this is that we tried to figure out, okay, so how much did everyone get stronger in each of the interventions? And was that what was driving how much better they felt? Okay, so I've gotten a lot stronger. I'm more self-confident. I feel better about myself. And it's really a strength-based thing. It turned out that no matter how much stronger somebody got, they were likely to still receive the same antidepressant benefit. So it wasn't the strength gains that were driving it. Even if someone didn't end up getting much stronger, they were likely to see the same antidepressant reduction as the person who was able to lift 700 times what they started. So that helps us think about this in a couple of ways. One, the active ingredient of the antidepressant effect of resistance training is probably something different than getting stronger. So there must be something else going on. Maybe the mechanism is somewhere else. Maybe what's happening is not strictly related to sort of muscular adaptations, but it's somewhere else. So that's led us to think about different ways that we might be able to consider what's happening when someone does resistance training that leads to changes in depression or in other mental health outcomes. So to summarize this section, we see the acute effects on the left, the chronic effects on the right. We see in general relatively consistent acute effects, but the chronic effects are as big as what we're seeing in many of our other interventions for depression, which is useful. The next piece is to try to pull in a different type of mechanism. So what is it that's happening when someone exercises that changes their depression? So to do that, you sort of have to figure out, well, what's going on in depression? Like what are the clinical features or the underlying neurobiology of depression that would tell us something about what resistance training might be targeting to improve that depression? Depression is tricky because there's no blood test for depression. You can't just take a blood draw, send it off to the lab, and then come back later and you've got 12 depression. All right, let's work on that. Because of that, it means that our ability to figure out what the mechanisms are underlying it is tricky. We have to first figure out depression and then figure out how resistance training works. So my job is hard, but it is fun because you get to figure out the different pieces of the puzzle. One of those pieces appears to be cerebrovascular impairment. So in people with depression, compared to healthy controls, people with depression have different regional brain flow patterns. When you look across a large number of people, you see reductions in right parahippocampus, thalamus, fusiform, and middle temporal gyri, as well as left and right insula. And those differences between healthy adults and adults with depression were also related to clinical features of those participants' depression. So the more severe, the larger the difference in brain blood flow in particular areas, suggesting that maybe the amount of change in the brain is related to the amount of depression that's present. This doesn't get at sort of chicken or the egg, like which one comes first, but it does say if these are associated and we change one, the other one might also change. So it gives us sort of a target to think about. Can we change brain blood flow patterns or improve blood flow in certain areas to get at treating underlying depression? We know that regular aerobic exercise, so people who consistently bike or walk or jog or engage in aerobic exercise of some kind, that improves markers of vascular health in the periphery, so throughout the body, as well as in the brain. We know that this increases the ability for the arteries to expand and contract in response to different environmental stresses, so changes in blood pressure, changes in carbon dioxide and oxygen within the blood. And we know that markers of neuropathology are related to sort of the health of the arteries that are part of the cerebrovasculature. So people who have lower levels of vascular health tend to have more gray matter atrophy or shrinking of the brain in certain areas, have a higher likelihood of white matter lesions, worse white matter integrity, and this leads to impaired cognition. So this is sort of thinking about like the cognitive function angle. If we're working with someone who has poor cognitive function and we work backwards, we see issues in cerebrovascular health. We also have some data to show that regular aerobic exercise would improve that. The question then becomes, well, what about resistance exercise? Does that also benefit the cerebrovasculature in a similar way or in a different way? And might that be how we end up seeing the reductions in depression that we would anticipate? So to figure this out, we are looking at this through sort of a mechanistic pathway linking resistance exercise training to decreases in depressive symptoms. And I realized when I got over here that my that I had a typo in the top part of the figure. Just pretend that I don't would be helpful. So we're looking at this as having people do resistance exercise that will increase their cerebral blood flow as well as their cerebral blood flow pulsatility. So how quickly does beat transmit through someone's vasculature, and how well is the capillary or whatever vessel able to both extend and then distend, with the idea that those cerebrovascular changes will be related to the changes we see in their depression at the end. That's the hypothesis that I'm working with Dr. Lefferts in the kinesiology department, who does a lot of the cerebrovascular function work, along with my own mental health side, to sort of try to piece this together and see if this is one way that resistance training might be helpful. So right now we're running a 10-person pilot project for adults with depression to undergo a 16-week intervention of resistance training to try to figure out sort of the earliest formative research. Is it feasible to have adults with depression perform a consistent twice-a-week resistance exercise training program? Is it acceptable? And might it even have some of the cerebrovascular or antidepressant effects that we're looking to get? But with only 10 people, you can't see too much. So we've got a 16-week intervention and a follow-up to see if does whatever changes that we see at 16 weeks sort of stick around. And for a lot of exercise research, this is really important because we know we can get someone to do just about anything for 8 weeks, 12 weeks, 16 weeks. We can change behavior pretty effectively if we pay them, if we incentivize them in other ways. But as soon as we remove the sort of intense monitoring, what happens? Do people continue to do the behavior that we tried to get them to do or not? And most of the times, the answer is they don't. But what does that mean for the health outcomes that we care about? Does that change their depression status, their cerebrovascular function? So the idea is that we would use this small pilot project to then resubmit a grant to the National Institute of Mental Health or the National Heart, Lung, and Blood Institute for a much larger trial looking at resistance training versus either health education or we're considering a different intervention control, maybe aerobic exercise or maybe some combined group. If you think you have participants who might be good for this study, feel free to send them to me, or we can connect later. I've got another slide on how we might be able to do some of that stuff. So that's putting together the cerebrovascular function, depression, and resistance training piece. For those of you who are just here to figure out, like, okay, so now I see somebody, what am I supposed to tell them? This is your section. We have some sort of clear recommendations from a number of the sort of world governing bodies related to health. So the World Health Organization, the American College of Sports Medicine, the U.S. Department of Health and Human Services all have the same recommendation for adults in relation to resistance training. It is at least 2 days a week to perform muscle strengthening exercise that targets all muscle groups. But that's it. It's not a lot of information. And for many people who haven't engaged in resistance exercise of any kind or muscle strengthening exercise of any kind, that's not going to be like, oh, okay, now I know what I'm doing. I'm going to go to the gym now. Or I'm going to start doing my own bodyweight exercises at home. So while it's useful and says like, okay, we have some idea of the frequency, maybe twice a week or maybe more, the type, so we should be getting for all major muscle groups, a little bit more information would probably be helpful. So for those of you who are actually thinking about like, okay, so I'm going to try to incorporate resistance training more regularly or more intentionally into the information that I give to people, what are some key parts of what that stimulus should look like that would be helpful for them? Well, this is pulling a little bit from the behavioral science part of the work that I do. We know that people who enjoy the activity that they do are going to do it more often. So is there some way that you can get people to engage in activities that they at least sort of like or they think they might like? Because that's going to be much more likely than it is if we give them a very strict, these are the exercises you need to do at the gym. This is how many times, this is the exact prescription. For some people, that'll be helpful. But for other people, it won't be, or it won't lead them to enjoy the activity very well. And we know that's a key part of getting people to keep doing it. So that might mean some people will go to the gym. Might mean some people will do bodyweight exercises at home, or people will do yoga or other types of activities that engage some of the muscle strengthening components of exercise. The other part is that we know that the frequency is related to the acute improvements in a way. So if we can have acute improvements right after an exercise session last for maybe 4 hours, for maybe 6 hours, and somebody engages in exercise every day, well, they're sort of always under the effect of that last time that they exercised. So it no longer really matters what their baseline was because they're always somewhere else because they've been influenced by that last session of exercise. So for people who are thinking about trying to use exercise in particular for mental health or mood management, frequency might be a really useful thing to think about. How can you try to integrate this into your day or your schedule in a consistent way that will allow you to see the benefits more often or more regularly? And then the last part, and this is one of the things that, I scratch my head about a lot, is how does it work? What is the thing that's happening when someone's doing resistance exercise that's changing brain function in some fashion? For some hypotheses in this area are that there's group dynamics or inter-individual interaction is really important for the positive benefits of exercise. If you think about someone with depression who's withdrawing, becoming more socially isolated, if you're giving them a stimulus that's going to sort of force them, accidentally or surreptitiously or something, to also engage with other people, those other social interactions might be doing the benefit of the resistance training for you. So it's not actually the resistance training, but it's all of those other things that come with it. So that's one hypothesis. And then another way is to think about let's go down the hardcore physiology route. What is the neural signature that's occurring while someone's exercising? What are the predictors of exercise? How can we use those pieces of information to help us create the programs that are going to be most effective? Because if we know how it works, then we can design the program most effectively to make it work the best most of the time. The final thing that I want us to think about is sort of where a lot of my research interests are going, is how do we get people to keep exercising? So remember I said we get everybody to exercise for 8 weeks or 10 weeks or 12 weeks. Maybe not all of us in this room want to sign up for that study, but theoretically we can get many people to change their behavior in the short term. The problem is getting it to keep going beyond that. Because if we can figure that out, that's going to be really important for us to sort of maintain population health. So what are those key predictors of long-term exercise? And are there any key moments where we might be able to leverage an intervention to maintain exercise behavior? What about that person who regularly comes into the clinic, who consistently said that they had been exercising, and now at one of those times when you ask that question, they say no? Is this a moment that we can leverage to sort of get them back on the bandwagon, where we can increase their likelihood of maintaining their behavior? Or there's some other sort of moments that we can identify where just giving the right intervention at the right point will be really helpful. We know that the people who do maintain their exercise for a long period of time enjoy it. They remember it positively. They think, if you were to think back to the last time you exercised, that would be a useful or helpful experience for them. That isn't necessarily the case for everyone, but that might be part of the exercise setup that we have. People who enjoy exercising stick with it, regularly attain goals, they set them and they hit them, and that benefits their likelihood of continuing to do it. And then they also identify as an exerciser. So when someone says, like, you meet somebody at an event and they say, oh, what do? You tell them your job, and then they say, okay, but outside of your job, what do you do? If one of the first things that you say is, oh, well, I like to run, or I like to bike, or I like to, play ultimate frisbee or something. If that's on the tip of your tongue, then you're somebody who sort of has an identity wrapped up in exercising, or in exercising in that way. And people who develop those identities, it's much harder for them to stop exercising. Now, this isn't the sort of exercise addiction talk. That's a different wait 2 months and we'll come up with that one. But it's the idea that people who see this as part of who they are stick with it, whether or not they want to in any given moment. But in the end, it's always about figuring out the mechanisms or how it works. If we can figure out how people who keep exercising, that would be really helpful. So let's go back to Gustav's living room. As he's setting down that 690-second repetition, what's happening with him physiologically, psychologically? What about particular brain pathways are activated or not activated? Why is it that he was able to continue to go all the way up until 692? And as someone who's probably started to identify as someone who's doing this, is probably going to do it again tomorrow or the day afterwards. What are the pieces we can learn from him that would help us to understand how to engage other people in resistance exercise training in a way that's likely to keep them at it after 2 months and see, big changes in capacity or in mental health? I think understanding this how piece is going to be key to helping us understand how best to intervene and support those major clinical concerns of depression, cerebrovascular disease, et cetera, that are going to keep on cropping up over time. So thank you all for being here. This is, I'd like to acknowledge and appreciate the funding that I've had, the major collaborators I have both at Iowa State and elsewhere. And then in the corner, without the lab team, none of the research happens. So I'd like to thank them for that. Thanks. If you have any questions, I'd be happy to answer them. Oh, one last thing. Sorry. References. I've got a bunch more if you want it. How might you be able to interact with me in this research thing? The bane of my existence is recruitment for all of my studies. For any of you who are related to getting people into doing anything, you probably understand. So a couple of things that I thought about that might be relevant here is that those of you guys who are either part of clinical teams or see patients yourselves, if you have patients with depression, you could certainly refer them to our studies, either as part of your standard or as something that you could offer on a sort of one-off basis. I know that every time people come in, like when I come to my annual visits, you always go through the patient health questionnaire 2 depression screening, that really brief depression screening. If we could recruit people who meet a certain threshold or send invitations to people who meet a certain threshold, theoretically that would solve the bane of my existence. I don't know if it would. Or based upon people's ICD-10 codes, so working with those of you who live in the medical records world, could be really helpful. Or we also try to recruit for many of our studies, both the resistance training study and then an active CBT study that I could talk more about with any of you later. And if you see those, please share those and help us try to recruit. So my bane will be less baney. That would be great. Okay, sorry.
Yeah. Do you see changes in like cortisol levels or endorphins that would explain the antidepressant effect?
Yeah, good question. So cortisol seems like, so for some depressed patients, they are either hyper or hypocortisolemic, depending on, there's different factors. And typically over resistance training intervention, that can tend to normalize over time. The endorphins piece is one of those things that whenever it came about in the 70s or something, it's sort of stuck. Unfortunately, endorphins are largely not the answer for the mood benefits of exercise. You can block the body's receptors for endorphins pharmacologically. And when you do that and you have somebody exercise, they feel as much better as they did without blocking it. So if that was what was going on, then you would think like, oh, that's going to reduce the benefit that they get. But we don't see it, and in animal models, we don't see it either. So endorphins are probably more affiliated with the pain responses to exercise. So people, after they exercise, have exercise-induced hypoalgisia, which means they sense less pain, or the same thing feels less painful. So endorphins are involved there, but less so in the sort of antidepressant or anxiolytic effects of exercise. Mm-hmm. Yes. So aerobic exercise in a number of the areas has been shown to improve. There's just a lot less total research on resistance training. So we're sort of like trying to pull together the information we have from aerobic exercise interventions along with what we would expect or hypothesize resistance training to do in those same areas, though it's not as, the data are not as strong. But one day I want to be able to present that information to you. Other thoughts, questions, comments? Should I be able to see the online people?
I did check with Tim, and he said there's no questions in the chat. So,
okay.
Thank you very much.
Thanks, you guys.